oral cancer is amongst the commonest cancer in a country. Maximum number of males, they have got oral cancer, and even amongst females, oral cancer is the second most common cancer after breast cancer. Now, the reason why such a high numbers exist in our country is because of oral tobacco usage. So, chewing of tobacco, supari, gutka, pan masala, all this is very prevalent, and uh, even a lot of surrogate advertising is regarding this. So, because of such prevalent things, and even uh, traditionally, as per our old customs, again, people end up chewing supari. They even offer it in our prayers and all. So, such customs are harmful and they lead to oral cancer development. Besides that, smoking, consumption of alcohol, and sometimes injury because of sharp tooth or sharp denture can also lead to oral cancer. Initially, oral cancer may be asymptomatic. By the time patients may realize that something is going on, what I want to emphasize out here is that pain may not really come initially. People tend to think, okay, I'm having a lesion inside my mouth, but then it is not painful, so it is not worrisome. But pain is a late symptom of cancer. If pain is there, that means whatever, if it is a cancer, then probably it's already in an advanced stage. Early cancers are painless. So the patient may be having a ulcer in their mouth, or it can be a growth, or it can be a white or red patch. Now, these white patches are called leukoplakia and red patches are called erythroplakia. These are precancerous lesions. They can develop onto cancer later on. So, any of these lesions, or like I mentioned, a growth, ulcer, these can be presenting symptoms of the cancer. Along with that, restriction of tongue movement, patient is not able to bring out his tongue, or the mouth opening has decreased recently, or a teeth has become loose or has started bleeding, or bleeding from any known lesion in the mouth is again a symptom of oral cancer. Besides that, the patient may also have a neck lump, which may be the presenting symptom for oral cancer. We examine the patient's oral cavity as well as their neck. Depending on what lesion we are seeing, we may ask for a biopsy. Now, that biopsy can be done in OPD basis. There is no problem with that. Sometimes people tend to think that biopsy can aggravate the disease spread, but that is completely unfounded. There is no basis to that thought process. Now, we need a biopsy. Along with that, we also at times need some scan. That may be contrast enhanced CT scan of face and neck, or a contrast enhanced MRI of face and neck, depending on where the disease is and what its extent is. Sometimes, depending on aggressiveness of the disease, we may consider doing a PET scan also. Oral cancer, the treatment is surgical. For early oral cancers, surgery alone is good enough. For advanced oral cancers, that is in stage 3 or stage 4, or where aggressive risk factors are present, even though this tumor is early stage, there the surgery may need to be followed by radiotherapy and or chemoradiotherapy. But the mainstay of treatment for these patients is surgery, where we remove the part of the oral cancer with margins. So, like, this is the tumor, I need to take margins all around it so that I am way beyond the tumor. And secondly, I need to remove neck nodes so that whatever metastasis there in the neck is taken care of. Of course, when I'm taking out some part of the oral cavity, be it tongue or your cheek or part of the jawbone, accordingly the debilitation exists. Now, for early oral cancers, generally patients are able to chew, able to swallow and speak easily. They don't cause much problem. But in advanced oral cancer, depending on where the tumor is lying, accordingly it may impact the patient's swallowing, speech, and even at times the outside cosmesis, because these things can be impacted. Nowadays, with advanced form of reconstruction like free flaps or uh, mini plates, we are able to take care of these patients and they don't have that much cosmetic disfigurement. But still, of course, some asymmetry may still exist. After the surgery, needless to say, like, patient will be having some sutures or repaired area in their mouth. We need to let that area settle down and heal properly. Till that time, the patient is fed through a tube in their nose. That's called a nasogastric tube, through which the food or diet is given. After few days, as the healing progresses, we can remove those tubes, and then the patient is able to swallow orally. Ways to prevent is, of course, to stay away from addictions like tobacco, alcohol, smoking. You need to stay away from them. Second is early diagnosis. In oral cancer, the advantage is we have got these precancerous lesions, like I was telling you about leukoplakia, erythroplakia, oral submucous fibrosis. These lesions can be easily identified, and when patient is aware that such lesions existing, if possible, these lesions should be removed. Early detection decreases the morbidity of treatment and also leads to better cure.